Hi. Just one moment. Hello, hello. Just one moment. To see the. Okay, fine. So, hello to all of you. Okay. Chalo, we'll start. So, bachcho. Hello, bachcho. And welcome back to the one shot series of anatomy. ठीक है, इसमें हम कुछ टॉपिक्स डिस्कस करते हैं विच आर वेरी इंपॉर्टेंट फ्रॉम द एग्जाम पॉइंट ऑफ व्यू, वाइवा पॉइंट ऑफ व्यू. ठीक है, तो आज का टॉपिक है पोस्टीरियर ट्रायंगल ऑफ द नेक, वन ऑफ द मोस्ट इंपॉर्टेंट LAQs ऑफ द हेड एंड नेक, द पोस्टीरियर ट्रायंगल ऑफ द नेक. ठीक है, स्टार्ट करें. यस फिलिप. नीट यात्री, विल स्टार्ट. फाइन. So starting with the posterior triangle of the neck, have a look at this. So I'll draw a slide for you, and जितने slides draw करते हो उतने अच्छा है. Okay, the more the slides you draw, the better marks, I mean the better representation you have. Okay, have a look, practice drawing the slides in the exams like this. Okay, what is this? ये क्या है? Mastoid process. That's a mastoid process. ये muscle का नाम sternocleidomastoid. That's a sternocleidomastoid. What is this muscle? What is this muscle? That's a trapezius. That's a trapezius. This is the body. I mean, this is the body, and that's a ramus of the mandible. ये है body, ये है ramus of the mandible. पिछला lecture देखा आपने? पिछला one shot. Yes. Hi, hi. Yes, Lakshmi. Hi, hi. Muthu Lakshmi. So the last lecture you have seen the venous drainage of the face. That's the body of the mandible. That's a ramus of the mandible. This is the angle of the mandible. Fine. So this is the body. That's a ramus. That's an angle. This is the midline of the neck. इसे हम बोलते हैं midline of the neck. And what is this here? That's a clavicle. That's a clavicle. Fine. So I'll just clear this unwanted things. Okay, fine. So now you tell me, ये है clavicle. Look at this. Just one moment. Okay, fine. So this is the trapezius muscle. This is the trapezius. That's a sternocleidomastoid. That's a clavicle. This is the midline of the neck. Midline. That's the body of the mandible. And we draw an imaginary line from the angle to the mastoid process. Angle से लेके mastoid process तक we draw an imaginary line. Swarnim, we'll see. We'll see. बोलता हूँ. Just wait. Let me finish this. Then we'll discuss how to improve upon. We'll discuss. So this is the side of the neck. This is the side of the neck. Side से देख रहा हूँ. So what are the boundaries of the side of the neck? Anteriorly is the midline. पीछे होगा trapezius. Below is the clavicle. Above is the body of the mandible, and imaginary line drawn from the angle to the mastoid process. This neck is divided into two triangles by sternocleidomastoid. What is this triangle? Anterior triangle. And ये क्या होगा? Posterior triangle. Posterior. Fine. Now what is this bone? ये क्या bone है? Hyoid. Hyoid. And there's a muscle here. What is this muscle? That's the omohyoid. Omohyoid. So ये है superior belly of omohyoid, and that's the inferior belly of omohyoid. The inferior belly of omohyoid divides the posterior triangle into further two triangles. The inferior belly of omohyoid divides this posterior triangle into a larger, this is the occipital triangle, and ये होगा supraclavicular triangle, supraclavicular triangle. Okay, so posterior triangle की boundaries clear है. The posterior triangle anteriorly sternocleidomastoid, behind is the trapezius, below is the clavicle. This posterior triangle is further subdivided into two triangles by the inferior belly of omohyoid. This becomes the occipital triangle, and this becomes the supraclavicular triangle or the subclavian triangle. Subclavian, fine. Okay, so boundaries clear hai, boundaries of the posterior triangle. Now we come to the floor of the posterior triangle. Floor, bas ye sun lo, samajh lo, all this is very important. Have a look at this slide. Look at this slide. So what is this muscle? What is this muscle? That's a sternocleidomastoid. What is this? That's a trapezius. This is the clavicle. So ye hai posterior triangle of the neck. Okay, what is this? muscle? Omohyoid. That's the inferior belly of omohyoid. So this becomes what? Occipital triangle, and this becomes a small supraclavicular triangle. Supraclavicular. Fine, boundaries are clear. अब ये जो muscles देख रहे हो, this muscles that you're looking at, this muscles are going to lie in the floor of the posterior triangle. This, hi Rabia, this muscles are going to lie in the floor of the posterior triangle. So floor of posterior triangle is formed by which muscles? Let us understand this, a very, very important thing. Floor of the posterior triangle is formed by what? Have a look. Once again, एक बार वापस draw करता हूँ मैं. You have to practice drawing the slides, huh? मतलब I am able to draw this so fast because I keep on drawing this, है ना? I keep on drawing this. So if you practice, you will get this. So that's a trapezius, that's a body, ramus, that's a midline of the neck. This is the clavicle. Okay, I start. The floor of the posterior triangle from above downwards. From above downwards. Okay, fine. Okay. I'll talk in English. Okay, so the floor of the posterior triangle from above downwards is formed by the following muscles. Okay, just try to understand. These muscles are new for you. You must not have heard these muscles. The first muscle here is known as the semispinalis capitis. Capitis, the head, begins from the cervical vertebrae, the spines, and goes to the caput. Caput is the head. The semispinalis capitis, that's the first muscle in the floor of the posterior triangle. Perfect. Hi, Aladdin. The second muscle here is known as the splenius capitis. The splenius capitis. So the first muscle is semispinalis capitis. The second muscle is the splenius capitis. This muscle begins from the cervical vertebrae and goes to the occipit, the skull. Right? Semispinalis capitis and splenius capitis. The third muscle, look, we know this muscle. This is what we call as the levator scapulae. Levator scapulae. Levator scapulae is attached to the scapula. Okay, levator scapulae, the muscle which is attached to the scapula, that's the levator scapulae. Fine. Now comes our three muscles. I'll just draw this in a different color so this will be clear to understand. Now comes this muscle and this muscle. Now what is this muscle? This is the scalenus posterior. And this is the scalenus medius. Scalenus posterior and scalenus medius. Fine. So semispinalis capitis, the splenius capitis, the levator scapulae, the scalenus posterior. This is scalenus. Scalenus muscle begins from the cervical vertebrae and goes to the ribs. Ye ribs pe jata, it goes to the ribs. So scalenus posterior and scalenus medius. This muscle is the scalenus medius. Now these muscles are going to lie in the floor of the posterior triangle. You just need to know this. Floor of the posterior triangle is formed by, clear to all of you, the semispinalis capitis, the splenius capitis, then comes the levator scapulae, the scalenus posterior, the scalenus medius. Scalenus anterior is not lying in the floor of the posterior triangle. Remember, this comes in the MCQs. The scalenus anterior muscle, it lies behind this. What is this muscle? The sternocleidomastoid. So scalenus anterior, it lies behind the sternocleidomastoid. So we do not include the scalenus anterior in the floor of the posterior triangle. Fine. Hi Aladdin, fine. Hello. Are you all able to follow this? So clear? Now all these muscles are lying in front of the cervical vertebrae. They lie around the cervical vertebrae, and all these muscles is what we call as the prevertebral muscles. All these muscles, they lie in front of the cervical vertebrae. All these muscles are known as the prevertebral muscles, and all these muscles would be covered by a fascia. Guess this. Guess what is that fascia? All these muscles would be covered by a fascia which lies in front of the vertebrae, lies in front of the cervical vertebrae. What is that fascia? Any guesses? Any guesses? What is that fascia? It's a deep fascia of the neck. It's a deep fascia of the neck. Whereas a deep fascia of the neck is of three types. Number one is the investing layer of deep cervical fascia. Second, one which covers the thyroid and the trachea, the pretracheal fascia, and the third fascia which is going to cover the floor of the posterior triangle. This is the prevertebral fascia, prevertebral fascia. So all these muscles are lying in the floor of the posterior triangle. All these muscles are covered by the prevertebral fascia. So automatically the prevertebral fascia lies in the floor of the posterior triangle. Are you able to follow this? All these muscles are covered by prevertebral fascia. So automatically the prevertebral fascia will lie where? In the floor of the posterior triangle. It will lie in the floor of posterior triangle. Following this? Okay, just have a look at this. So have a look at this muscles. I'll just label this for you. The first muscle up here is the semispinalis capitis. That's a splenius capitis. That's a levator scapulae. That's a scalenus posterior. That's the scalenus medius. This scalenus anterior lies behind the sternocleidomastoid. Perfect. So that's the floor, and all these muscles are known as the prevertebral muscles. Just have a look at this slide. What is this section? How are you looking at this section? Can anyone tell me? This is a section of the neck. This is a section of the neck. Now tell me if this is anterior and this is posterior. Anterior and posterior. Fine. This is a section taken through the neck. Okay, now you tell me what is this muscle? This is the trapezius. This is the trapezius. What is this muscle? Sternocleidomastoid. That's the sternocleidomastoid. That's the trapezius. That's the sternocleidomastoid. This is the midline of the neck. Midline of the neck. So what is this triangle between the sternocleidomastoid and the trapezius? What is this triangle? That's the posterior triangle of the neck. And between the sternocleidomastoid and the midline, what is this triangle going to be? The anterior triangle of the neck. Are you able to understand this? Muthulakshmi, just refresh karo, just refresh it, refresh the channel. Okay, so this is the posterior triangle. So this is the sternocleidomastoid, that's the trapezius. This forms the boundaries of the posterior triangle. And look, students, what is this? What are these muscles? 1, 2, 3, all this muscle. This is going to form the floor of the posterior triangle. Are you able to follow this? And all these muscles are covered by this fascia. Look at this fascia. Look at this fascia. What is this orange fascia? That's the prevertebral fascia. So this prevertebral fascia comes to lie where? In the floor of the posterior triangle. Am I perfectly clear to all of you? So this prevertebral fascia comes to lie in the floor of the posterior triangle. So boundaries is clear, the floor is clear. Fine. Okay, now we come to the contents of the posterior triangle. Okay, now just try to understand the same slide. Same slide I'll draw in a different way. In a different way I'll draw this. Just one moment. Where's the slide gone? Where's the slide gone? Okay, so that's the floor of the posterior triangle. Now understand the contents of the posterior triangle. Contents. The same slide I'll draw in a different view. Just have a look. Okay, these are the cervical vertebrae. Just try to understand this. Try to understand. If this concept becomes clear now, it will be very easy for you to understand. This is the first rib. There's a tubercle on the first rib. That's the scalene tubercle. This is the scalene tubercle. Hi, Bhavish. What is this? This is the manubrium sterni. That's the body of the sternum. This is going to be the clavicle. This is going to be the scapula. That's the humerus. That's the humerus. Where are we? Where are we? That's the axilla. This area is the axilla, correct? This is known as the apex of the axilla. That's the apex of the axilla. Okay, fine. Just have a look now. So that's the manubrium sterni. That's the clavicle. This is the scapula. This is the first rib. That's the first rib. This is the apex of the axilla. This is the axilla. Fine. Just try to understand the concept. Okay, I start. Now, from this cervical vertebrae, a muscle begins. See, this is beautiful. Just try to understand. From the cervical vertebrae, a muscle begins and comes to the first rib. From the cervical vertebrae, a muscle begins, comes and gets inserted on the scalene tubercle of the first rib. This is known as the scalene tubercle. This muscle is the scalenus anterior. Scalenus anterior. A muscle begins from the cervical vertebrae, comes and gets inserted on the first rib on a posterior aspect. That's the scalenus medius. Scalenus medius. Muscle begins from the cervical vertebrae and goes to the second rib. I'm not drawing the second rib. That's the scalenus posterior. Now go up, go up, go up, go up. What's this? The levator scapulae. Levator scapulae. Further going up, this is the splenius capitis, and that's the semispinalis capitis. Semispinalis capitis. Students, what is this? That's the trapezius. And what's this? That's the sternocleidomastoid. You're following? So what is this that I've drawn for you? This is the floor of the posterior triangle. You're looking from front. You're looking from front. Samne se, from the anterior view. And the same floor of posterior triangle, this is a side view. Following this, that's a side view. This is an anterior view. Same hai. Trapezius, sternocleidomastoid, clavicle, that's the posterior triangle. These muscles are going to form the floor of the posterior triangle. All these muscles are covered by the prevertebral fascia. Perfect. Perfect. Right. Now just try to understand this. Look, who's this? Who's this? That's an arch of aorta. And who's this? Who's this? That's a subclavian artery. The subclavian artery crosses the first rib and now becomes the axillary artery. That's the axillary artery. So the subclavian artery goes behind the Scalenus Anterior. The moment it crosses the first rib, it becomes the axillary artery. It comes down. Fine. Something else here. This is C5, C6, C7, C8 and T1. And what's that? That's a brachial plexus. Brachial plexus. So now you tell me, students, what am I asking you? This subclavian artery and the brachial plexus, where do they lie? They are going to lie in the posterior triangle of the neck. And what are they going to form for the posterior triangle? Yes, the subclavian artery and the brachial plexus, what do they form for the posterior triangle? Any guesses? You can see this? You can see this. What is this? What is this? What is this? Yo. What's that yellow thing? What is that yellow thing? That's the brachial plexus. Yo, that's the brachial plexus. So this brachial plexus is going to form a what for the posterior triangle? The content of posterior triangle. Samajh mein aa raha hai? Are you able to follow this? Boundaries are clear. Floor is clear. Now I'm coming to the contents of the posterior triangle. What is the content? Number one is the brachial plexus. Number two is the subclavian artery. The same thing I was trying to draw here. Look at this. So that's the brachial plexus. That's the subclavian artery. This comes to lie in the posterior triangle. That is going to form the contents of the posterior triangle. Hello, students. Following now? Huh? So contents mein, one is brachial plexus, second is subclavian artery. Fine. Now coming to the next content. The next content is, have a look. Hey, look, students, there's something very important nerve lying on this muscle. What is this muscle? That's the levator scapulae. This muscle is the levator scapulae, and the nerve lying on the levator scapulae is the spinal accessory nerve. The spinal accessory nerve. So the spinal accessory nerve lies on the levator scapulae in the posterior triangle of the neck. And this spinal accessory nerve first supplies the sternocleidomastoid. This nerve first supplies the sternocleidomastoid, then comes in the posterior triangle of the neck, lies on the levator scapulae and goes to supply the trapezius. It then goes to supply the trapezius. Fine. So ek minute, students, don't get confused. Number one, boundaries are clear of the posterior triangle. Number two, floor of the posterior triangle. These muscles are clear. Now I'm discussing the contents of the posterior triangle. Contents of the posterior triangle mein, number one, what we discussed is the brachial plexus. Number two, what we discussed is the subclavian artery. Number three, the third content is, yes, the third content is what? Hi, thank you, bache, thank you. The third content is a spinal accessory nerve. And this spinal accessory nerve lies on which muscle? The levator scapulae. That's a very, very important MCQ. The spinal accessory nerve lies on the levator scapulae. And this is extremely important. This is the most important content of the posterior triangle. Why? Yes, Bhavesh. Yes. Wait. Now this, look. Just try to understand. In this posterior triangle of the neck, there are plenty of lymph nodes. Bahut sare lymph nodes. There are plenty of lymph nodes. And this lymph nodes becomes matted. They become hard in tuberculosis, right? So this posterior triangle of neck has got large number of lymph nodes. The lymph nodes becomes matted, they become hard, they matted, matlab they stick to each other. That's in tuberculosis. The spinal accessory nerve is very superficial. It gets caught in this lymph nodes, it gets entangled in this lymph nodes. Now we are doing a biopsy, we are removing a lymph node, and when we are removing the lymph node, the accessory nerve accidentally gets damaged. Following this is the importance of posterior triangle of the neck. Why is it clinically important? Because in the posterior triangle there are plenty of lymph nodes. This lymph nodes becomes matted in tuberculosis. The spinal accessory nerve gets entangled into this lymph nodes, and when we are removing a lymph node, this accessory nerve gets damaged. Now the MCQ is, damage to the spinal accessory nerve in the posterior triangle of the neck leads to paralysis of which muscle? Answer this. Damage to the spinal accessory nerve in the posterior triangle of the neck leads to paralysis of which muscle? Yes, answer this. Yes, Vishnu. Yes, Amina, Amiha, Bhavish, Rabia, Muthulakshmi. Answer. If the spinal accessory nerve is damaged in the posterior triangle of the neck, which muscle is paralyzed? A very, very important MCQ. Very important. Yes, very good. Yes, Rashid. What's your name? हाँ, fine. Sternocleidomastoid को कुछ नहीं होगा. Sternocleidomastoid is saved by, because the nerve first supplies the sternocleidomastoid, then it comes in the posterior triangle of the neck. So if we cut the nerve in the posterior triangle of the neck, who's affected? Trapezius. Sternocleidomastoid is intact. No, sternocleidomastoid is intact. Pravat. Levator scapulae का सवाल ही नहीं. Levator scapulae is not supplied by spinal accessory nerve. No, the spinal accessory nerve is just lying on the levator scapulae. Fine, levator scapulae is supplied by nerve to rhomboids, dorsal scapular nerve. You are following? The spinal accessory nerve supplies two muscles, sternocleidomastoid and trapezius, but it first supplies the sternocleidomastoid. Then it comes in the posterior triangle of the neck, and then it goes to supply the trapezius. So if by chance, by mistake, I cut the nerve in the posterior triangle of the neck, who's affected? Trapezius. What will the person complain of? Difficulty in shrugging of shoulders, difficulty in overhead abduction of arm. This will be the complaint of the patient. Fine, clear to all of you? Understanding? This is very important. So, bacho, what are we discussing? The contents of the posterior triangle. So, contents of the posterior triangle mein, number one, what we discussed is the brachial plexus. If I have to draw the brachial plexus, I'll draw the brachial plexus here. Between the scalenus, sorry, not here. I'll draw the brachial plexus between the scalenus anterior and the scalenus medius here. That's the brachial plexus. What else was here with the brachial plexus? Yahan pe thi. Who else was there? Subclavian artery. So brachial plexus, subclavian artery is here. Then comes the spinal accessory nerve, and around the spinal accessory nerve we get a plexus. The name is cervical plexus. Cervical plexus. There's a group of nerves. I'll just tell you. There's a group of nerves. Okay, number one, have a look. There's a nerve which winds around the spinal accessory and goes up to supply the skin over the occiput. It supplies the skin over the occiput. The name is lesser occipital nerve. Lesser occipital nerve. Okay, so what are we discussing? The contents of posterior triangle of the neck. Number one is the brachial plexus. Number two is the subclavian artery. Number three is the spinal accessory nerve. And number four is the cervical plexus. It's a plexus. It's a bunch of nerves. So there'll be branches of the cervical plexus. The first nerve which winds around the spinal accessory and goes up to supply the occiput, skin, lesser occipital. The nerve which goes and supplies the skin over the angle of the mandible. Who's this? That's a greater auricular nerve. Greater auricular nerve. There's a nerve which goes transversely in the neck. Transverse. Neck is cervix. Cervical. Supplies the skin. Cutaneous. Transverse, cervical, cutaneous. And the last one goes above the clavicle. The name is supraclavicular nerve. Supraclavicular nerve. So this becomes the contents of the posterior triangle of the neck. I hope you're understanding this. That's a, I mean, it's in plenty of things are there in the posterior triangle. Fine. So one is the lesser occipital, second is the greater auricular, third is the transverse cervical cutaneous, and fourth is the supraclavicular nerve. Just have a look at the slide. Have a look at this slide. Oh, here it is. Look at this. If you can answer what is this nerve, number one, that's a lesser occipital, that's a greater auricular, that's a transverse cervical cutaneous, and that's a supraclavicular nerve, the supraclavicular nerve. So this becomes the contents of the posterior triangle of the neck. Students, are you able to follow this? So, एक मिनट वापस again boundaries are clear. Sternocleidomastoid, trapezius, clavicle. The floor is clear. The semispinalis capitis, the splenius capitis, the levator scapulae, scalenus posterior, scalenus medius. The floor is covered by the prevertebral fascia. Coming to the contents, brachial plexus, subclavian artery, spinal accessory nerve, the cervical plexus, and there's one more artery. The name is occipital artery. There's one artery here. The name is occipital artery. Here. Occipital artery. So this becomes the contents of the posterior triangle of the neck. And last comes the roof of the posterior triangle. Roof. All these branches of the cervical plexus, they are going to supply the skin. Ye skin ko supply karte hain na. All these branches of cervical plexus, they go and supply the skin. So all these branches of cervical plexus would be piercing the fascia, and they will be coming in the roof of the posterior triangle. So these branches of cervical plexus, they are the contents plus they'll be in the roof of the posterior triangle. So roof of the posterior triangle is formed by the skin, the superficial fascia, and there is one more fascia. I'll just tell you this. Look at this red one. What is this red one? This is known as the investing layer of the deep cervical fascia. This is going to form the roof of the posterior triangle, the investing layer of the deep cervical fascia. So roof is formed by the skin, superficial fascia, the one in red, investing layer of the deep cervical fascia, the four branches of cervical plexus which comes to supply the skin, and a vein here, name is external jugular vein. Bas itna yaad rakho, remember this much, external jugular vein. Vital, don't worry, next time do well. Next time do well, bache, don't worry. You understanding this? Clear to all of you? So roof of posterior triangle is formed by skin, superficial fascia. Number 3 is in red, investing layer of the deep cervical fascia. Investing layer of the deep cervical fascia. Then comes what? Then comes the 4 branches of cervical plexus and the external jugular vein. External jugular vein. That's it. That's about the posterior triangle of the neck. Any doubts, any difficulties you have, you tell me. Any difficulty, any doubts? You have, you tell me. Okay, so posterior triangle is an LAQ. Draw plenty of diagrams, nothing much to write, but you draw plenty of diagrams. First, the boundaries. Yes, draw the diagram for the boundaries. Second is the floor of the posterior triangle. Draw the diagram for the floor. Next comes the contents of the posterior triangle. Again, draw diagram for that. And finally is the roof. Clinical anatomy mein, clinical anatomy, what are you going to write? The spinal accessory nerve lies on the levator scapulae. There are plenty of lymph nodes here which gets matted in tuberculosis, and when this lymph node gets matted, the accessory nerve is entangled, gets caught in this lymph nodes. So when we are excising the lymph nodes, you have to be very careful because the accessory nerve may get damaged. Fine. And suppose if the accessory nerve is damaged in the posterior triangle, who's affected? Trapezius. Not the sternocleidomastoid, the trapezius. That's a very, very important MCQ. Clinical case comes like this. Clinical case discussion. A clinical case discussion would be something like this. Akshat. I'm Akshat, Nigam. I'm telling you, same thing. I'm repeating the same thing. A 40 years old female underwent a cervical biopsy. Yes, lymph nodes, yes. Underwent a cervical biopsy. After the surgery, the female noticed that she cannot lift her hand to comb the hair. Understand? She cannot lift her arm to comb the hair. So what is your diagnosis? I mean, what has happened? So the spinal accessory nerve is damaged. What muscles does it supply? It supplies the sternocleidomastoid and the trapezius. Understand? So that's how the clinical question comes. So if your concepts are clear, you will be able to answer any clinical question. Fine, students. I hope I'm clear to all of you. And keep on watching the one-shot series of anatomy. And thank you from the entire team of PW Meded. Thank you. Fine, I'll stop you. So that's about the posterior triangle. किसको कुछ doubts है? Any doubts anyone has? Yes? Any doubts? Okay, thank you. I'll stop. Bye-bye.